A new report claims King Charles will be pausing his ongoing cancer treatment during his upcoming royal visit to Australia and Samoa. On October 6, the Daily Mail reported that the King's medical team has given him permission to temporarily halt his supposed weekly treatments during the long-distance trip, which runs from Friday, October 18, to Saturday, October 26. Interrupt. The Mail understands that His Majesty will continue his cancer treatment until he leaves, but his doctors have agreed that his cancer treatment will be temporarily suspended during his absence, the outlet reported. The King will resume his treatment cycle once he returns to the UK, the outlet said, noting that his treatment will be weekly. Next week, King Charles, 75, and Camilla, Queen of Scots, will begin a trip to Australia and Samoa, their first visit to Commonwealth countries since ascending to the throne. It will also be the royal couple's first major overseas trip since Buckingham Palace announced the King's cancer diagnosis in February. On February 5, the palace announced. It was revealed on the 5th that King Charles was diagnosed with a form of cancer in January after being treated for an enlarged prostate. A spokesman clarified that he did not have prostate cancer. On the advice of his doctors, the monarch postponed his official duties and continued to work behind the scenes from that date until April 30. He then resumed royal duties and visited the Macmillan Cancer Centre at University College Hospital. The hospital is not directly involved in the King's treatment, but highlighting the importance of early detection was one of the reasons the King made his cancer diagnosis public. A Buckingham Palace statement announcing King Charles's return to public duties said the King's treatment was continuing. The publication did not say when the King's treatment would be completed, saying all future plans would depend on medical advice. Future plans will in due course follow medical advice and, where necessary, appropriate adjustments will be made to minimize any risk to His Majesty's continuing recovery, a palace spokesperson said. In the months since, the ruler and some of his family have spoken out on occasion about his diagnosis and health. It's always a bit of a shock when you're told, the royal reportedly told a patient at the Macmillan Cancer Centre in April. Meanwhile, when Camilla was asked about her husband during a solo stay at the Royal United Hospital in September by someone, she responded that he was doing very well. 3. The 77-year-old King and Queen have busy schedules in Australia and Samoa, and are due to attend the Commonwealth Heads of Government meeting (CHOM) in 2024. The summit takes place every 2 years, and there has long been speculation about his attendance, as he is head of the Commonwealth of Nations, which has 56 member countries. The palace said the couple's activities in both countries will celebrate the best of Australia and Samoa and focus on themes that reflect aspects of the King and Queen's work, but that the itinerary has been altered for health reasons. The British royals would normally have visited Commonwealth country New Zealand during their long-haul trip to Australia, but medical advice ruled this out. A spokesman previously said, the King's doctors have advised that such a large-scale program should be avoided at this time in order to prioritize His Majesty's continuing recovery. When the Australia and Samoa visit was announced in July, a Zealand spokesman said, due to time and logistical pressures, it has been agreed to limit the visit to Samoa and Australia. Buckingham Palace added that the royals extend their sincere gratitude and best wishes for their continued support and understanding. King Charles practiced a traditional Samoan dance at a royal reception honoring the Commonwealth diaspora on October 3, after which he rested in Scotland before embarking on an epic trip to Australia and Samoa, the Daily Mail reported. These 2 weeks leading up to the royal tour have been deliberately casual for His Majesty. He will continue to attend meetings, complete paperwork and come here for treatment, a source told the outlet about the King's plans for the next few days. Australia is a big deal and he wants to be at his best. It's a chance for a workaholic like him to take a bit of a breather, the source said.